Hello, everyone. I'm Kim and Alleyne, and today is Tuesday, November 26th. You are now watching Open, a program that brings the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. Reach Out and Read is a national nonprofit that champions the positive effects of shared reading and engaging in other language rich activities with young children. They believe that there is a strong connection between early literacy and healthcare. Joining me now to discuss this matter is the CEO of Reach Out and Read, Marty Martinez, and a Greater New York clinician for Reach Out and Read, Dr. Vanessa Salcedo. Thank you both so much for joining me.
Thank you for having us.
Now,
Thank you.
Marty, to start us off, can you first tell us a little bit more about Reach Out and Read?
Yeah, absolutely. Reach Out and Read is a national network organization that partners with clinicians all across the country to integrate early literacy and children's books into well child visits for children 5 and under across the United States. It's a very simple model that partners with clinicians, helps to train them on how to use children's books as part of these visits and giving children and families new books to take home with them. It strengthens early literacy, early bonding, early brain development, and it really creates opportunities to create moments that matter for children and families each and every day.
Now, I kind of want to expand on that in this very fast paced world. Why do you strongly feel that encouraging parents and guardians to get, involved with their kids in reading is so important?
Yeah, I mean, the science is clear, and Dr. Salcedo, I'm sure will say more about this, but the science is clear that, when a child is read to at a young age, well before they even know the words on the page, but when a child's read to at a young age, it stimulates brain activity. It creates more movement around a child thinking about, words and sounds and language as it develops. And it also strengthens the early bonding between a parent and a child, all things that are really important in the earliest development of children. But also, as we think about kindergarten readiness and the building blocks to learning to read, it really does create that solid foundation. If you've ever read to a child, as I'm sure folks have, you know that bonding and connection that happens during reading, but that has a magnified impact. And that's why we believe so passionately that children and parents should have these opportunities.
Now, Doctor, as mentioned, you work alongside Reach Out and Read. Can you tell us why you got involved?
Well, luckily, when I started at Union Community Health Center, it was already a Reach Out and Read site. So that means that we get donated books from the Reach Out and Read Greater New York chapter, and we provide them at every well child visit, as Marty mentions, under 5 for every well child visit.
Now, can you just explain how long this, partnership and how long this has kind of been going on with Reach Out and Read?
So luckily, my clinic has been part of Reach Out and Read since the early 2000s, before I was even there. But over the last 3 years, I became a champion, a provider champion, which really embraces every single part of the early literacy. We really train our staff. We have residents. We teach the residents on how to give the books to the families, how to engage and use it as a developmental tool. And as Marty was saying, it's such an important part of development. And I really want to tell the families and point out that 80% of the brain is developed the first 3 years of life, and reading is essential for that growth development.
Thank you so much for sharing that. Now, Marty, can you just kind of explain how is Reach Out and Read committed to making sure families and children, particularly those who live in underserved communities, have access to these free books?
Yeah, I mean, part of the main work of our organization is to ensure that families have access to our model, regardless of zip code, regardless of where they get their care, regardless of sort of who the care is provided by. And that's making sure that we bring books that are not only diverse and reflective of the community, but also bilingual. In Greater New York City alone, last year, we administered about 325,000 books across the entire city. And those books were delivered in about 16 different languages across Greater New York. and making sure that those books can actually reach families, so that when a family and child gets a book from a doctor, they see themselves in the stories and the images that are represented, and ensuring that those stories reflect sort of the community at large, but also that individual family. So for us as an organization, we really are taking an equity lens on how we grow, making sure that we're going to places that may not be able to get books, may not be able to have access to the program, and training clinicians and working with them so that all families have access to this evidence-based program. So it's very important for us to do that in all places, and that's really what we're striving to make happen, especially across New York City.
Oh, well, I'm so glad that you mentioned the different languages because we do have some books here
Great.
that are in English and Spanish. Now, I'm curious to know for a young child, I know we think that, oh, this may be complicated, but how does a young child learn about different languages as they're kind of learning to read and speak in general?
Yeah, so their brain is rapidly developing. So the more languages they hear, the better it is. So when back before we used to think that no, they should only, like you mentioned, speak one language. No, the more exposure. And what's even more important is that many of our families are monolingual in their native language. And
Mhm.
when they get a book that has their native language in it, they get excited. The grandma, the mom, the caregiver, feels empowered to read the book to their child, and it encourages their culture, as Marty mentioned. And you can see by the books here, which are bilingual and culturally relevant to our population.
And how does that promote healthy brain development?
Well, in like Marty mentioned, and what we were talking about, if you think about it, when the baby is born, they're not doing much. They're looking around, they're smiling, but before you know it, they're sitting up, babbling, and by 3, they're running around and saying cute things. And the way the brain develops is the way you interact with the baby. So the more you interact with them, the more you read, the more you talk, the more you give them things to play with, it helps the neurons grow. So millions of connections in the brains are happening when you're interacting and bonding with the child. And we know that this is essential the first 3 years of life. I know parents think if you give them a screen, like a phone, that might help. It actually shows the opposite effect. The brain develops that it gets used to that fast interaction, and what reading does, it helps you slow the brain down for complex thinking. So it is amazing, and we're really giving tools to families to help their brain grow.
That's amazing. Now, Marty, I'm curious to know, maybe through your work, how have you seen this impact a child's maybe their confidence, how their willingness to like speak to different people and learn more? How can reading impact those areas of a child's development?
Yeah, I mean, as an organization, we see it all the time. We see, clinicians not only telling us the stories of their engagement with families, but also, seeing a child from birth to the age of 5. You see that development, and oftentimes we'll see our medical champions across the country talk about how they've seen, growth and development within the use of words, and then going from sounds, and then going from understanding letters as they get a little bit older, and then that connection that a parent makes with those child around sort of word development, and sort of being able to sort of see that in those visits. We also have a lot of research studies that show that over the past couple decades, our model really promotes shared reading. So parents who are exposed to our model are 2.5 times more likely to read to their child on a regular basis. That's very, very powerful. We say this a lot, that parents are their children's first teacher. And a lot of times parents don't realize that just spending time together, looking at the words, sort of making sounds, and being connected to that is really impactful for that development. As Dr. Salcedo said, as a father of a young child, I can't tell you how many times I've been a dinosaur, a fire truck, an animal, spending time with my son. But I know that the sounds we're talking with together, the words that we're sort of making up, it helps it get his brain moving and to think about language, and to really get him to have a love for reading, which also promotes that well beyond the ages of our program. So we know how powerful it is and what it does to strengthen a child's development.
Now, I'm so glad to hear that because I'm curious to know, could you just tell us a little bit more about the organization's goal to serve 10 million children by 2030?
Yeah, absolutely. So right now across the country, our latest numbers are just coming out. We serve about 4.6 million children nationwide. So that is about 20% of all children 5 and under in the United States. So our goal by 2030 is to serve 50% of all children across the country. And that includes in places like New York City, where we have to have a lot more books, a lot of diverse books, bilingual books, reaching a diversity of clinics. It also includes in other places across the country to get into rural places, support tribal health, immigrant health, doing a bunch of work across the country to meet the needs of communities and to grow rapidly across the country. We can't do what we do without great champions like Dr. Salcedo. And so in order to do that, we need more doctors, more nurse practitioners, more family doctors and pediatricians to be able to deliver our model. So we don't want just some children to have access. We want all children to have access. And that really means building a movement of more support, more resources to create these opportunities for families.
Now, Doctor, I kind of want to end on a note, just talking about the future of education in books. There seems to be a lot of threats on education or, just children reading, with the rise of technology. What do you hope to see for the future of books, in a child's life?
I hope that kids get engaged. I want to thank Marty and the Reach Out and Read program because in our community, we give them, because of this program, their first books. And we give them books at every visit, so almost every 3 months. So they are building that library from early childhood. And we hope that this program and these books really help our children succeed throughout life. And without the program, I know that our kids wouldn't have the success that they do with development.
Well, with that, I want to thank you both so much for joining us. As I mentioned, there's a lot going on, with the state of education and, technology is taking over, so more children are interested in tablets. But it's nice to see that there is a space where we're growing for children to read. And I think the work that you both are doing are amazing. So once again, thank you so much for joining us.
Thank you again for having us.
Thank you.
To learn more about the work Reach Out and Read is doing, please go to their website at reachoutandread.org. Don't go away, we'll be back with more Open right after this.